Maybe going back to Kenya, a number of years ago, the government announced a Linda Mama initiative, which was a free health um, services for free maternal health services for pregnant women. And this was a it was a national initiative and, highly, broadly spoken about nationally. But again, this issue of operationalization of it was not clear. It wasn't clear to health workers in terms of how they were meant to access or being reimbursed for the services delivered through the scheme. It wasn't clear to communities in terms of how what were their entitlements. And so we worked in one county in Western Kenya, to really engage with healthcare providers as well as community health workers to address those two challenges. So we engaged with health facilities to train them on exactly what the package of services was, how they should be able to seek reimbursement and make claims through the system, using mobile money to access that funding. And to kind of all of the administrative processes that they needed to be able to access that funding. At the same time, we engage with community health workers to inform and educate communities about what they were entitled to, because that's often a huge barrier to access, is that people don't know what they are entitled to. We had a similar issue in Nigeria, where there's the basic healthcare provision fund and the challenges that people didn't actually know what was in it, and so they don't demand services from the health facilities because they aren't clear about what those services that they are entitled to by law to access. So through those two initiatives, we were able to increase uptake of those free healthcare services for maternal health. I think that county then became one of the front runners in terms of awareness and access to maternal health services.